Hi, in this video I want to talk to you about how to understand your blood test results. Many people go to the doctor, they get the results, and they just don't know what all these numbers mean. Please stay tuned to find out. Hi, I'm Dr. Joe with 2 Minutes to Better Health. Well, it's a very common phenomenon. You go, you're kind of excited because you're not feeling very well and you just want to see what's wrong with me, and you get the blood test back and maybe everything looks normal and you're like, and you're kind of frustrated because you don't want to be sick, but you also want to know what's going on with you. Or maybe you go and you feel fantastic and you get the results back and numbers are all marked and flagged and it just doesn't seem right. So you see all these different words and many of them don't make a lot of sense, and you see this range of things that you're supposed to fall within. But understand, people are very different. So is a low normal good? Is just below normal good or bad? And does that mean that you're sick in some way? Well, that's really what I want to help explain here today. Realize that people are very different. So their findings on blood tests will be as well. I mean, some people are shorter, taller, some people are very large in their stature, and other people are much smaller, older, younger. All these different things are going to affect it. So when you look at blood test results and they show you that range, it's around where the 95% of people should fall. Okay, there's the high and the low end, and then there's that peak in the middle. But people will fall on the ends and actually in many cases be okay. But unfortunately, you look at that, it's going to be flagged and it may make you feel like there's something wrong with you. Symptoms. Now, what if it says that it's normal, but you don't feel normal? Now, that's a big thing. A lot of people go, they're just really looking for answers, but it says that everything's in line. But your symptoms are all over the charts, and you have to realize that symptoms do have a lot to say about whether you're doing well or not. So even if the blood test says it's completely normal, you may not be. But fortunately, you may be catching something before it becomes a diseased situation. So that's a good sign, but it may not help you in that situation. And on the flip side, if it says it's abnormal, but you feel the best ever, maybe you lost 20 pounds, you're on some great new diet and everything looks great, your hair, your skin, your nails looks great, everyone just compliments you on how you look, but now you've got some weird markers and it's like, wait, what's going on? Is this a good or a bad thing? And finally, realize the blood is for transporting, it's not the destination of things. This is key. Blood is the carrier. It's like the roadways. If there's trucks on the road and they're carrying all sorts of freight and cargo, that's great, right? But if they never get off the road, they never go to the store to unload it, it's never going to get to where it needs to get to, and that's key. So let's say you went to Walmart during the pandemic and there's nothing there. Well, maybe the trucks have things, but they just can't get it to the stores because of different situations, or there's things being closed down. Well, that's a similar situation. Calcium's a perfect example. I'm going to talk about that in a moment. All right, so normal and abnormal. These are like 5 of some of the key blood test results that I like to talk about. Hemoglobin A1C, that's an indication of your blood sugar levels. Okay, so if it's in that range of, it's below normal, that's great. But maybe you're just feeling tired all the time in the mid-afternoon. Maybe you do have blood sugar issues, but it hasn't yet gotten to that level of where it's showing that you're pre-diabetic or diabetic, because maybe you have high insulin levels, but maybe not high sugar levels all the time. So realize that some of these things can throw you off. Total cholesterol. This is a big one. A lot of people go and they get their cholesterol checked. They're feeling great, but their cholesterol is at 205. That's their total level, but it's supposed to be 200 or less, and they're all upset because I thought everything was great. Realize it's not just the total cholesterol or HDL or LDL. It's often the ratio. So if the ratio says everything's in line, but your total cholesterol is a little bit high, yes, deal with your doctors with this, but realize you may be going in the right direction towards improved health, but that number does not indicate who you are. It just indicates a direction or a trend. And realize trends have a lot to do with this. Are you improving in the overall results, or are they declining? That has a lot to do with it as well. Calcium. Calcium is a big mineral. We've talked about this at length in the past videos, but realize calcium has to go to the tissue. If you're cramping up all the times in your legs and muscles and you can barely walk up a flight of stairs and you get Charlie horses at night, you're probably low in calcium, but your blood test is going to say calcium's right in line, it's perfect, because again, it's delivering it, it's in the blood, but it isn't getting into the tissue. Your tissues need to absorb these things, so you may have an issue absorbing it into that, but the blood test may say it's okay, but you may be low in it. So that's an important thing to talk to someone who understands how to get it to where it needs to go. Okay, maybe a natural provider of some sort. TSH, it's another key thing. A lot of women especially, they get their blood test back. TSH is right in the middle. That's the thyroid stimulating hormone. It says everything's great, but they have every thyroid symptom you could possibly imagine. Hypo, hyper, whatever it might be. But the TSH is only one of many different blood tests you can do. There's T3, T4, and others more advanced, even looking for autoimmune conditions. So realize one test alone does not indicate good or bad. It's part of a blend of different things. So someone who can really read these things should help you with that. Vitamin D levels, so many people are low in this, but they get their vitamin D levels back and it says it's at 31. Yeah, that's great. It's at the lowest end of normal, but okay, you're fine. You can stop taking your vitamin D now. but it's in the middle of winter. I can guarantee in about 2 weeks you're going to be in the low end of that, or if it's at like 12 or 15, it's ridiculously low. And sometimes, remember, the ranges are not always the best indication of things. You may want to be towards the higher end of the range, or even maybe slightly above that in some cases, because just like this, your vitamin D level is going to drop very quickly if you're not consuming it on a day-to-day basis through some supplementation in the winter or something like that. So with all this being said, this doesn't give a complete answer of what blood tests mean, but do understand it's part of the picture. Symptoms mean a lot. You might be slightly on the high or low end of that normal range, and that's okay. Talk to your doctor, talk to your natural provider, do some research yourself, but realize it's just part of the picture. Just wanted to give you a little understanding to look at blood tests a little bit differently. Just don't go on it alone, because that'll make you very stressed out, because when something's wrong on that and you feel okay, it's going to stress you out, and stress isn't good. So hopefully this was helpful. I look forward to seeing you in a future video. Have a great day.